Good morning and welcome to today's webinar. Today we'll be talking about the Cal OSHA emergency rules for COVID-19. This includes identifying COVID-19 hazards, drafting and implementing a COVID-19 presentation program, investigating cases, and providing testing to potentially exposed employees. My name is Jake and I'm part of the team here at CalWorks Safety and HR. As always, our goal is to provide current information with the understanding that this can change in the future. We will continue to give you access to new webinars as we have updated information, so be sure to look out for our email updates. Before we begin, I would like to remind our attendees that you are in listen-only mode. If you have questions during this webinar, please feel free to utilize the chat box to ask your questions, and our speaker will try to answer as many as they can during the last 10-15 minutes of the webinar. I will be helping to facilitate your questions. If we do not address your questions today, or you would like to receive a copy of all the slides, just send us a note at info@calworksafetyhr.com, and we'll help you out within 24 hours after the webinar. There's a lot of information to cover, so let's try to hold those questions until the end, as we may address them during the presentation. Now, I would like to introduce our speaker for the day. Don Dressler is a founder and managing partner of CalWorks Safety and HR. Don is a practicing attorney specializing in employment law and human resources issues, and consults on insurance and risk management issues for private companies and trade associations. Don has served as a director on the executive committee of the California Coalition on Workers' Compensation, chairs the annual Irvine Police Department Awards Banquet, is treasurer of the Exchange Club of Irvine, and serves on the board of directors for Western Family Services. Dressler is a frequent speaker on workers' compensation, health insurance, human resources, and organizational development issues. Please welcome Don.
Good morning and happy almost Christmas to everyone. I'm just reminding you, as Jake said, that this is the most recently available information, including information from the governor's office in the last several days and the Equal Employment Opportunity Commission, who just issued some rulings and interpretations. And this is an area that changes frequently, so you need to come back, and you also have to keep track of federal, state, and local public authorities, depending on where your operations are. This is just a recap of some of the things that have happened this year. On March 19th, the state issued its first stay-at-home order, which basically, for non-essential industries, closed operations, closed restaurants, and severely restricted our economic activity. It was partially reopened on the so-called Blueprint for Safer Economy, August 28th, 2020. Then the governor issued in November a limited stay-home order, or a curfew, between 10 p.m. and 5 a.m. That order also includes a direction to quarantine yourself if you go out of state and then return to California. We had then, subject of most of today's presentation will be new Cal OSHA rules that were promulgated in a hurry in late November, approved by the Office of Administrative Law November 30th, and became effective 12/1/20. And these are 9 actions which apply now to all employers in California. Since December 1st, we've had the regional stay-at-home order, which was effective in Southern California on the 6th of December. We had a revision to these rules by an executive order of the governor and Department of Public Health, limiting or changing the orders of length of quarantine required on December 14th. And that changed the Cal OSHA regs too. It wasn't initially clear, but the governor issued an order amending the Cal OSHA orders as well. And then just recently, EEOC has announced regarding requiring use of vaccines. Also, there are a number of cities and counties that have their own ordinances, such as the City of Los Angeles, the County of Los Angeles, Beach, Pasadena, So you need to know where your operations are, what laws apply, and they don't all change at the same time. So what the emergency regulations required are some specific actions for employers, some of which some of you have already done and others maybe you haven't done. But the first is to identify COVID hazards in your operation and include employees in that identification. In that process, what we suggest is you walk your property or your operation with a clipboard and have a couple of employees go with you. And then you make notes of what you saw, because under Cal OSHA, if it isn't written down, it didn't happen. So you need to prove you did an assessment, and you also need to show employees participated. Based on your hazards of your operation, you need to write a written COVID prevention plan. Now, some employers followed Cal OSHA guidance earlier this year and had a preliminary plan. Unfortunately, the new regs don't track exactly what the original indications were. So if you had a plan that was written in June, July, August, September, you ought to take a look at it to make sure it's current now with the new Cal OSHA requirements. And there's also a requirement to train employees. The third piece is the requirement to investigate COVID cases. And this is something that's happening regularly to many employers now. So when a COVID case is defined as a case where a person tests positive, not one that says, oh, I think I have COVID or I was exposed to a person with COVID. These rules start if somebody tests positive. And then you have to notify employees, you have to notify your workers' comp insurer. Depending on the number of people involved, you may need to notify others, and we'll talk about that as we go through. You also need to provide testing to potentially exposed employees, and that means that provide testing at company expense on company time. Fortunately, there are a number of public testing sites available throughout Southern California, which offer no-cost testing. You can also use CVS stores, and certain cities sponsor. For example, Irvine has a testing facility in the Great Park. So you need to look around and know where testing is available. It's important to have rules and to enforce them that require physical distancing and wearing of masks. And employees should wear masks whenever they're not in their home or alone in their own car or alone in an office with a closed door. So that means most of the time, most of us should be wearing masks. And more people should be wearing masks than have been. We need to check the ventilation of your property and maximize outdoor air. Fifth requirement from Cal OSHA is to keep employees who are ill out of the workplace. And that means until the quarantine ends. At this point, the requirement is to pay employees one way or another, and we'll talk about that because that doesn't necessarily mean writing a company paycheck when someone's quarantined. You also have to keep a record of your Cal OSHA cases and report information, and we'll go through that again. You have to report outbreaks, which are 3 or more employees who don't live together who report COVID within a 14-day period to the local public health department. In Orange County, that's the LA Public Health Department. If you're in another city or county, you need to check and see what's the proper jurisdiction. In Los Angeles, the Los Angeles City has its own public health department, and the county has the public health department. City of Long Beach and Pasadena have their own public health officers, but most people in Los Angeles, if they're not in the city of LA, will be reporting to the county Department of Public Health. If you provide housing, there's a requirement to provide social distancing and disinfecting services. And if you provide transportation, and this applies to some companies where they have employees ride together in company provided transportation or who go together in a truck or a van to do work. So there's certain things that apply there. There have been over 20 citations by Cal OSHA for safety violations
On Sunday.
before the new
Okay.
regulations.
Okay, let's do that.
Yeah, Doug?
Okay.
The lowest
Do that,
fine
Okay, thank you.
was for failure to inspect the COVID premises for COVID, which was a fine to that employer of $17,895. Other fines range from $35,000 to $101,000. Be aware that the Cal OSHA has added 40 new inspectors to its workforce. And in the past, when they got a complaint from an employee, they would send the employer a letter asking about compliance with COVID safety. Now they're going to be sending out inspectors, and they're going to ask for a copy of your hazard inspection. They're going to ask for a copy of your COVID plan, and they're going to ask for proof of training, which means who was trained by whom on what topics on what days. So this is a much more serious documentation requirement than you may have experienced in the past. So what is a COVID case? Somebody who's either tested positive for COVID or is subject to an order to isolate, which could be by a local city or public health agency, or they've died of COVID. So most people are dealing with people who have tested positive for COVID or who've been told by their doctor to quarantine. That's the most common situations I find. What is exposure? Exposure is being within 6 feet of a COVID case, meaning a COVID case is somebody who's tested positive, for a cumulative 15 minutes or greater in any 24-hour period. Now, there are also some high exposure periods. And this applies whether you have a face covering or not. So you are exposed if you're close to for a person with tested positive, whether you both were wearing masks or not. Wearing masks doesn't prevent it from being an exposure. Also, this applies to any work location, working area, or common area of work where the COVID person was, which is one of the reasons you need to do the investigation. Somebody tells you they have COVID, you ask, how do you know that? What's your basis? Is it a test? Is it a doctor? Is it a word of mouth? Second, where have you been and when, so that we can carry out our duties underneath the rules. There's a change slightly in the exposed workplace on January, but that really doesn't mean much significantly for an operation. What is the time period involved? The relevant time period is a person 2 days before they develop symptoms until 10 days after the symptoms first appeared. This is what has been identified for regulatory purposes, the period when they can expose others to the disease. There are about a third or more of the people who test positive for COVID who never show any symptoms, who are called asymptomatic. For them, the test period, or the time period involved is the 2 days before and 10 days after their positive test was collected. Time becomes important because it has things to do with when you have to give notices and when you have to pay or make other actions to employees. So you have to have a written COVID prevention plan, which is kind of like what we used to have, or most companies still need to have, is their illness injury prevention plan. But the elements need to have how to report a COVID symptom, what exposures the employee has at your premises, and that is arrived at primarily from your hazard inspection. How do you accommodate employees with medical conditions? How do you test for COVID or tell your employees about COVID tests? Do you have a policy? And you need to have a policy on screening everybody who comes into your work site. They can screen at home. They could screen at the front door with somebody asking questions. You could take temperatures. Temperatures have become less an indicator because there's so many diverse symptoms of COVID And often in the early stages, a person doesn't have a temperature, and in many cases never does develop a temperature, even though they have other symptoms. But how are you going to check employees every day when you arrive at your workplace? This can easily be a worksheet or a checklist that you give employees. They could complete it at home and bring it with them, or they could answer questions when they arrive at your workplace. How are you going to ensure physical distancing, meaning the 6-foot spacing? And realize you need to provide face coverings, perhaps gloves or other personal protective equipment, depending on your hazards. You need to describe how the employer will respond rapidly and effectively when COVID cases occur. So this all kind of runs together, and I know it does, but there is a suggested format from OSHA. We have available suggested formats, and we are very happy to have our team, and we do write these plans for employers so that it can be carried out. In the plan, you need to describe how you investigate a COVID case. And there's an important concept here, because although this is OSHA, there is a workers' comp rule of law involved also. And the workers' comp rule makes you responsible if you know or should have known a person had COVID. So you cannot just wait for somebody to tell you they have COVID. You have to have affirmative steps you take, which is one of the reasons you do the daily screening, because that's a way of showing whether you knew or should have known that someone had COVID. In your plan, you need to discuss your employee training program. And I will tell you that there are a number of resources available for training. Los Angeles Department of Public Health has an online training program that's pretty good. California Department of OSHA has a training program now. There are many posters that are free in many languages available from the Centers for Disease Control. If you need help with training materials, please let us know. The employer has to also maintain records of what you did to implement your plan, because once again, OSHA doesn't believe it if it's not in writing. So before you write your plan, in looking at your hazard assessments, investigate and basically walk through your whole workforce and see where people interact. Where do people come together within 6 feet? What are they doing? What equipments and materials are they using? Because COVID is spread by respiratory particles in the air, or particles that have been expired by a person or expressed by a person who land on work surfaces. So what you're looking at is who could be in an area to breathe air from an infected person, and who's in an area that touches work surfaces that could have had their breath particles land on. Then you talk about how do you reduce the hazards where people may interact. So this could be a variety of things. It could be plexiglass partitions. It could just be moving people further apart. It could be splitting shifts so people work different times. Not every interaction can be avoided because you still have to run your business. So what you're looking for is what can we do that makes sense, that improves safety. And the regs require the employer to have employees participate, and we're suggesting you do that right up front by having a couple of employees join you in your walkthrough or hazard inspection. You also need to look at your ventilation system and see if you're bringing outside air in or having a filtered or purification system. There are extensive guidances for every type of industry. The address for OSHA, or the California site we put at the end of this program, gives extensive multi-page guidelines for any kind of work. You also have to periodically inspect your premises, which we would suggest in this time be at least weekly, to show that you're keeping on top of things. If a person reports COVID, which means tested positive for COVID, you need to ask them when they were last present in your workplace and the date of the positive test or diagnosis. and the date that they first had symptoms. And this is just questions. They tell me about this. Many times people hear somebody's got COVID and then that ends the conversation, but it really doesn't end the conversation. It should start the conversation. Once you hear their story about where they've been and when, then you need to take a look and see who could have been exposed from them. Where did they work? What did they do? What locations in the premises did they visit? Because that gives us an idea of who is in the exposed situation. To those people who are potentially exposed, you have to tell them about the COVID site. And there's some other things that you need to tell them in that notice. You also have to offer people who have this potential exposure, which is not everybody in your building, but it's people who've been within 6 feet for 15 minutes of a person with COVID. You offer them testing at your cost, which hopefully is no cost because you're using public services. But it is also working time to perform the test. It gets more serious if you have what we call an outbreak, which means 3 or more employees reporting COVID within a 14-day period. And then a serious outbreak is 20 or more employees within a 30-day period. But we're talking about people in one workplace, one building, one unit, not all of your employees everywhere throughout California or throughout the world. We're talking about people who were in the area where they could have been exposed. If you have an outbreak, you have to notify the local public health agency. They will then want to know more details about the people who had the outbreak. And they have forms and letters that they'll provide to you. You also have to offer testing to all employees in the exposed. Now, offer testing doesn't mean make them take a test. It simply tells them of the exposure and that test is available at no cost to them. You also need to train. And information that you need to tell them are what benefits they get if they get COVID. And they have benefits under federal, state, or possibly local laws, but certainly federal and state laws. Employees must be instructed that COVID is an infectious disease. And if you haven't figured out that was the case, you surely learned it in the last 2 or 3 weeks here in Southern California, because we are going crazy with infestation and infections. And it's spread when people talk or sing or sneeze or cough or exhale, and then their particles get on their hands, and then it gets onto objects like desks, photocopiers, and wrenches and doorknobs from their breath. And the employees need to be trained about that. And the employees also need to be trained about the importance of social distancing and wearing a mask. And this is not a political discussion. This is a life-saving discussion about wearing face coverings. And there's 2 times when people don't have to wear a face mask, other than when they're in their own home or in their own car. And that's when they're in church or they're engaging in a political protest. So they want to go out on the street and protest that you make them wear masks. They're entitled to do that. And they don't have to wear a mask when they're protesting about masks. But when they come back in your building, they got to put the mask back on. You also should remind them about frequent hand washing with soap and water. Employees should be instructed on the importance of not coming to work when they're sick, and tell them what the symptoms of COVID are. So physical distancing is one of the keys to success in this operation. Some number of companies have people working by telephone or working from home or from remote locations. The other opportunity is to reduce the number of people who are in your work area, exclude visitors, have signs that have one-way traffic flow, stairways, one up and one down. And you've probably seen that, and you've been out in the public. A number of retail businesses and so on have done this. You could consider staggering when people arrive. You don't want 20 people arriving all at the same moment at the front door to be checked in, and by necessity, they're all going to be close together. So think about it in terms of start of work, departures, work schedules. And also think about the way you're doing your work, and is there a way to increase physical distancing? Disinfecting is important, and if you use a janitorial or a maintenance service, have that discussion with them. Ask how they're doing the cleaning and disinfecting of your operations. We suggest that you have hand sanitizers and, if possible, alcohol wipes at your facility at the entrance and readily throughout to make it easier to help clean. Don't let people share equipment if you can avoid it. And if they have to share equipment, have a way to disinfect it between uses. Returning to work following COVID. Employers must ensure that COVID cases are excluded from the workplace until the return to work requirements are met. Now, again, COVID case is somebody who's tested positive for COVID. But if you think they're sick, you tell them that you can't come to work until we know whether you're sick or not. So that's when you would say, go get a test or go call your doctor, because we're not going to be, we're responsible if we know or should have known that you had COVID. So the work rules have changed, excluding people from COVID, from the operation, from 14 days to 10. That just happened. And you need to provide testing. When people have symptoms, they should have 24 hours since they had a fever of 100.4 or higher. Their symptoms have improved, and it's 10 days since they first had symptoms. COVID cases who have tested positive but were what we call asymptomatic, never developed symptoms, should not return to work for a minimum of 10 days from the date the test was collected of their first positive test. A negative test is not and cannot be required for employees to return to work. But what you can say is you have to quarantine for the amount of days. You can't come back to work early. And if you want to come back, you have to have a negative test. We can't tell you you have to take a test, but we can tell you don't get to work here. And then you need to keep track of your COVID cases, the employee name, who they could have contacted, where they worked, because the public health agency likely is going to ask you this information. Another California new law that's now in effect requires you to notify your workers' comp carrier when you know or should have known an employee has tested positive for COVID. This does not apply to people who work from home who don't come to work, but anybody else who tests positive for COVID. And it's not whether they tested positive for COVID because of exposure at work, it's that they tested positive for COVID and then they worked at your premises. Also, when you have an outbreak, which we discussed earlier, which is 3 or more people within 14 days, you need to notify the local public health agency. And you have to give notice to the employees of potential COVID exposure within 1 day and have a record that you did that notice. And the penalty is $10,000 if you don't give the notice. So you want to be sure to have a form already prepared for when you need to do it. Or some of you have already had those forms because you've already been using them. If you provide transportation, meaning you have employees drive some work location in your company vehicle, you need to figure out how you're going to offer social distancing and require them to wear masks in the vehicle and increase the outdoor air, which means having the windows open even in nice, cool weather, and implement a disinfecting process or cleansing process for the vehicles, as well as already you knew isolate any COVID cases. Employees excluded from work but otherwise capable and available to work. Employees shall continue and maintain employees' earnings, seniority, and other employee rights and benefits as if the employee had not been removed from their job. Employers may use employer-provided sick leave for this purpose, but you also can consider benefits provided from public sources determining how to maintain earnings, and that would include state disability insurance administered through SDI. It could consider vacation pay or paid time off. It may be workers' comp benefits because it's a work-related exposure. You're entitled to use as many different sources, and also you can use funds from the Families First Coronavirus Response Act, that new law that Congress passed back in the spring, which required paid sick leave for up to 10 workdays. The problem is that law expires December 31st, 2020. It was a good law because it let you recoup or get reimbursed the cost of the pay to your employee from your federal payroll taxes. We don't know whether that's going to be in the emergency new authorization that Congress may or may not pass. They may pass it tomorrow. They may pass it over the weekend. They may have to come back after Christmas. We don't know. I don't think they know, but when they figure it out, then we'll tell you about how that helps you if it does. So we have the Families First Act, which I just talked about, that has an expiration date on it now. We have a newly enacted California law that applies to employers with over 500 employees. Now we have the OSHA rules regarding exclusion that require pay. You have state disability and possibly paid family leave, because if a person's off work to care for a family member who has COVID, they would be able to get a benefit up to 8 weeks of pay from the paid family leave. Now there's the maximum amount of pay in both SDI and family leave, so you may need to supplement that, but it's certainly better than being responsible for the total cost. There are certain county or city ordinances that require supplemental pay. We have our standard paid sick leave law, which for most employers is 3 days per year. There's also the opportunity for them to get a leave of absence under either family medical leave or the California Family Rights Act. And although it's not pay, it's an obligation for the employer, because people with COVID are qualified for protection under the Americans with Disabilities Act and the California Fair Employment Housing Act. And that involves discussing with the employees their work limitations. And you may just have a personal leave policy that the company has. So there are other ways employers get in trouble because of COVID, and we just want to bring them up to you. You can have negligent claims. If you are ignoring the OSHA rules, you can be faced with what we call a serious and willful claim. And a negligence claim, meaning you didn't keep your property clean. There's also the potential for OSHA citations, which can be quite expensive. You can have a wrongful death claim, which should be covered by workers' comp. But if the person was infected by your operations but not involved with work, I don't know how that would happen. That's a potential lawsuit. We now have a presumption about workers' comp and COVID under California law, which is a whole nother topic for another day. And also typical complaints that people are bringing now are failure to provide proper protective equipment, meaning face gears, gloves, eyewear, whatever. Failure to implement screening policies, which means the employee gets injured. Failure to clean the premises properly. This can be brought as an individual claim or as a private attorney general action we call PAGA claim. You can have an allegation that you didn't provide a safe and healthy workplace. If you fail to provide personal protective equipment, or failure to have requiring employees to work in an unsafe place. These are just so you know that there are dangers out there. You have to pay people for time involved realizing pay claims can apply. So people are waiting in line to be screened. That's working time under California law. If you send somebody home for failure to pass your screening, you have what we call show up or reporting in pay, which means paying them for 1/2 of their regular shift with a minimum of 2 hours and a maximum of 4 hours. You may need to pay people for standby or on-call time if you require them to call in to be told whether to come to work or not. And this is not limited to COVID. These are just wage and hour claims that come up from time to time. You need to either provide or reimburse for their personal protective equipment and testing, and track their use of paid time off or sick leave on pay stubs, so you have payroll reporting. And if people are being laid off, terminated, you need to pay accrued vacation or paid time off. If you're in an essential industry, that makes a difference. But in the governor's latest shutdown order, there are particular restrictions, and you probably know this, on indoor playgrounds, hair salons, barber shops, restaurants, amusement parks, movie theaters, and so on. So the order prohibits any size of gathering outside your own household members for many industries except for critical infrastructure, and requires 100% masking and physical distancing. Hopefully you've heard on the news all about this stay-at-home order and what it means. If you need more details or know whether you're qualified as a critical or essential industry, www.covid19.ca.gov is the all-purpose website, and it's again an excellent source of materials. Or you could also ask us, and we'd be glad to try and help you. So that is what I wanted to share with you. And also, I realize it's complex, and I realize that it's trying to get to. There we go. I hope this is helpful. I know it's frustrating, and I know it's complex because you say, well, I heard an outbreak was 4 over here and 3 over here, and it changed yesterday because Cal OSHA said something, and now the governor said something else. And all of us, I think, are living through this. The good news is the governor told us that we have the light at the end of the tunnel. This is just a tunnel. I don't know that I can put a date. I hope things are nicer for Valentine's Day. But the original stay-at-home order for Southern California expires the 21st of December, and surely it's going to be extended. You know that because of the incidences of cases we have. So I kind of talked a lot. Now we're interested in what questions you have. One question I had is, we all work from home. The good news is everything I've talked about today doesn't apply if everybody works at home. It doesn't go to your office building. Some people who work at home occasionally go to the office for mail or other things. When they go to the office, it counts. But everybody who works from home is not covered by workers' comp, is not covered by a requirement for a plan, is not covered by a requirement to pay if they have the disease. All of these rules apply to people who are working at a work location. So that's one thing that makes it easier. Any other questions? Well, with this, I don't want to, I just want to let you know that we are recording this and it will be posted on our YouTube channel. Jake's a master formulator for that. We also have a copy of the PowerPoint. I know there was a lot of text in these PowerPoints, but there's a lot of details in these rules, and I didn't know how better. What we've tried to do is bring them all from different sources to one place where you can see it. And we also promise to keep you updated as things change, which they will.
There are a lot of questions in the chat.
Okay, if you got some questions that you see, let me know.
Okay. Cal OSHA offers a free training on the website and provides their employees with a certificate upon completion. Oh wait, that was not a question.
It's true. That is, and it can be used, and it's a helpful option for some of you.
Okay. Does the outbreak reporting for employers have to be reported only in the county of the employee or also employee's home if outside of Orange County?
Only the company's office location. And let me add, there's one other report that I noticed wasn't on the slide. If you have an employee who's hospitalized because of COVID, this is a serious illness that has to be reported to the district office of Cal OSHA near your location. That now will surely bring a Cal OSHA inspection to your site. So if you have someone who is hospitalized by COVID, within 8 hours or 8 hours of when you knew they were hospitalized, you need to notify the local office of Cal OSHA. Then I would suggest you call somebody like our team who can come in, and often we can do an inspection before the Cal OSHA inspector arrives, and also check your documentation and help you avoid unnecessary citations or problems with Cal OSHA. Another question that looks, I mean, what we do to help you is we'll conduct a hazard inspection, or we'll conduct it with you if that will help you. We will write the COVID plan for you, or he'll write it with you if you'd like. We will help you with COVID investigations if one of your employees reports COVID. We're here to be able to help you comply with the steps. We can give you sample notices you have to give employees. There's a lot of moving parts in this process, and we're trying to make it as easy as we can for our clients to comply.
Can we advance an employee's vacation pay to cover an absence due to COVID-19 quarantine?
You can advance it if they agree. You can also require people to take vacation, but it requires an advance notice. So when they tell you they're COVID, it's too late to impose mandatory use of their vacation. But that's where you need to look at how your vacation policy is written. And if it's a paid time off policy, which includes sick and non-sick time, that makes a difference. So you need to look at your policy and see what it says. But most employees are going to want to get paid one way or another. The good news is the SDI benefit is available to them without any waiting period. So that's after the FFRCA benefit of 2 weeks, my second place to turn would be SDI.
Should we have a different type of letter for employees depending on if they were actually exposed to COVID-19 case or if they just happen to work in the same building?
I would suggest you have 2 letters, because there's much more particular information you have to tell people who have a potential exposure. There's a general notice you need to give to people who are in a building where a person reports as COVID. So my thought would be you'd use the general letter for generally people who are in the building, and a specific letter, and we can help you with those forms.
Okay. If the employee has a negative test result and the employer cannot ask, and the employee has to continue quarantining for 10 days after taking a test, will they still be paid enough through the FFCRA for those additional 10 days, even if they got a negative test result?
The FFCRA, which of course may expire here December 31, is a pretty significant amount of money per day that covers almost all of the people, our workforce employees. Some high paid people earn more than $500 a day, but many people don't.
Okay. Marcella Flores says, we don't have an office and we all work from home. There are only 9 employees. Do we need to have a written plan and training in line?
Yeah, and the answer to that is no. You're one of the. However, I had a question from a presentation I did a few days ago, and as well, we all work from home except we come to the office when necessary. So that coming to the office when necessary opens us up to the whole question. Okay, what are the rules and when do they come? You know, are they coming to check the mail? Maybe somebody's got to pick up the mail. They're coming to get supplies. Well, that puts them in your office. So that puts you in the need to have a hazard inspection and a plan.
Let's see. Did I miss any questions?
Well, if we didn't answer your question, please use our email address and send them, because we have a team of people who have worked very hard on this. Wendy Garcia, Cindy Williams, Ralph Doran, Nora Gomez, Victor Gonzalez works with us now on OSHA Matters. All of us are working as hard as we can to be available to you, to help you, to conduct inspections or help you write the plans. Make sure you know what you need to know.
Okay, and then I see one. Oh, wait, couple more. Do you have a template that we can give the employees who tested positive as to what their benefits may be?
Yeah, we have a sample notice.
Okay, and then we have Bill says we have a couple newly reported cases at an apartment property we manage in Santa Ana. Because the tenants made us aware of their positive test result, do we need to notify other residents of this situation, or is it a violation of HIPPA?
First of all, you never would tell anybody in a notice the name of the person who was reported as having COVID. That's the HIPAA protection. There is no HIPAA protection for telling people that someone in our building has tested positive. And the implications, well, you need to notify your own employees that a tenant has tested positive. And I have my office in a 16-story office building, and I regularly get notices of anybody in the building who's reported as COVID. So I think it's not quite like the Prop 65 notices outside of every parking garage. Every time you walk in, you know that they're cancer-causing and materials, including gasoline, that have been in this garage. But you do need to make sure that you do provide notice. Don't take it for granted.
Let's see. I think that's all the questions I see. Oh, one more. Do you have a suggestion for how to track COVID-19 exposures in the workplace?
The best thing to do is, that's all part of your COVID case investigation. So you should have some questions that you ask anybody who reports that they have tested positive for COVID. Including in that would be questions of, when were you in our work site? Who did you work with? Who did you associate with? Who were you near? What equipment you used? And it sounds like a lot of work, but if you just make it easy and a routine, make sure you ask the questions, you'll be in a good position then to make decisions on what actions you need to take, where cleaning needs to occur, who needs to be notified. Okay, well, thank you very much. I hope this was helpful. We're trying to present a Zoom workshop the third Thursday of every month. So our next one will be in January. And if there are topics that you'd like to see us cover in these workshops, send us an email and ask, because we would love to provide help and training. I know this is a difficult time, and we're doing everything we can to make it as easy as it can for you to operate and be successful and comply with the law. And in the midst of all this, have a very social distancing Merry Christmas.
Oh, wait, we have 2 more questions actually.
Okay.
Can Don elaborate on the FFCRA? If we can't require that the employee give us a negative test result, how would we know if they actually took a test? And what if the employee lies about being positive in order to take advantage of the FFCRA?
So our recommendation is that they either give you a copy of their test results or a letter from their medical doctor. If they don't do either one of those, they're not qualified employees. Because it is true in some work sites that there have been people who've been trying to take advantage of the system. And you've all seen the cases in the news about fraud in the unemployment claim process. So the only way you can make sure and have documentation is either to know the details of the COVID test or at least the name of the medical provider that they're directing. And our advice is ask for a copy of whatever work restrictions the medical provider gave them. The medical doctors will do this. They're more than happy to write them, but you need to know what the facts are for that circumstance. And if they don't do it, they don't get paid and they don't work. It's that simple. Because this is too serious to not obtain compliance.
Okay, last question. If somebody is out sick with COVID symptoms but never gets a test, do we have to consider they are positive and exposed others?
No, they're not a COVID case if they don't test positive. And you don't know whether they tested positive unless you get details on the test. So that kind of is the beginning definition. They're not a COVID case if they don't test positive. Now, I will tell you that there are take-at-home tests. Some of our staff have already taken them and used some of them. These are the ones where you take it home and FedEx it off, and you get responses back in about 36 to 40 hours. And in January, we'll have the much less expensive take-at-home tests available. And in those take-home tests, the person will get a text message to confirm their positive or negative test results. And so that will be available as evidence to an employer of what the test results were. But you can still use the free testing sites. Unfortunately, it takes longer to get the notice of what the results were in the public testing sites. Okay. Thank you guys so much. I hope this has been helpful. And let us know if there are other topics or if you have questions. Take care.